things that are going to happen literally when you're post-op laying there. Now they call this the pelvic clock, and you can imagine that you're laying on a clock. So this is noon or 12, 6, 3, 9. So all of you do is just, in a sense, tailbone down and tailbone up. But most people think that that's muscle-based. It's actually more your feet. So when the foot goes in, and you just pretend like you're just stepping on a bug, and see that automatically should ride my pelvis. Now you're more used to this right now, right, with the scoliosis. So when you do that, you'll actually get a tilt. So if I press in with my right foot, my left foot will go, and you know what I mean? Whereas with the straighter spine, it'll go straight. So this will help at least start getting you neutral. So if all you're doing is literally like feeling your feet pressing into the ground, this will help you to walk to the bathroom, you know what I mean, start to get up, because true locomotion is two opposing forces. So my foot goes into the ground, my hand, so I'm opposing. That's true movement. It's not, you know, where the feet are up and I'm pulling. So when a baby goes to do it, to roll over, they actually push their belly, can you see right there, and they get over. Now, everything's going to readjust for you in a kind way from pillow height on down. You might be used to this kind of pillow because of, or even one higher because of the back. When this straightens, you might actually feel like your head's going into the ground and you might need a lesser of a pillow. Those are things, again, you're just going to have to used to and adapt and figure it out. So when you're over, see most people are doing this to roll over. Belly, you literally can just roll right over. It's just a buoyancy law. But with everything needs a little practice. Now, when I'm on my side, I literally can have this tied to my bed right here, and I can be just like this working on my hands. It doesn't take much, but you can be, again, just tap out from anesthesia and just be this tired. But what you're looking for is just, again, to start that rotation. All of that kind of, now you can do this with finger, each finger. You could be watching TV, you could be listening to your roommate snore, whatever it is, and be working on this. Now what's interesting though about the bands, so you can be here, the band will be a bit higher. Same thing, you can start twisting, just have them strapped across you. You can be doing that. I'm just laying here doing absolutely nothing, right? I can be twisting. But since they're strapped to the hospital bed, what's nice about it, you can also be pulling, right? And you can be pushing down. So this is a really nice skill to work with. So the bands will be here, and you're just going to be pushing. See, if I have this in my hands, I can't work on those skills. But just to work on this, but also if it's tied to something, like to the bed, you can also work on pulling, right, from the sides. So there's lots of skills. So you can work on going up this way. You can work on going down. You know what I mean? Depending on where you have the bands. You can go pull them apart. You can pull them in. You can just work on one hand with the wrist like this. This is going to be closing your car door. All these things. Now, as you start to feel better, start to incorporate the feet. So with the feet, if I'm pushing down, then I want to push into my feet. That's your pelvic clock. And coming down, up like this. If I'm pulling on this side, right, then I want the right foot to work on that counter and work on that counter. If you're really getting adventurous, or later on, you can put the bands even over and work on some kind of, again, overhead, pushing the feet down, pulling, twisting from here. You can also go lower. Now lower can be done on your feet as well. but literally just this simple. See, I can work on pulling up. I can work on pulling up. I can work on, this is getting my socks on. Do you know what I mean? Just a nice simple, but I'm laying down in bed. I'm already working on this therapy and I'm not even close to doing it. But at least you're getting the precursor. But if it's too hard to keep on your feet, the bar in the bed goes all the way down to here. Just tie the bands a little bit lower and you can work on, again, more of that variation. Whatever you're comfortable with.
Tie it on with a knot?
You can tie it on with a knot, or you can get a little hook in Walmart before you start, that they put on the edge of the strollers. Do you ever see people have the hook their handbags?
Yes.
You can get that, pre-tie them, you know what I mean, and just once you're there, you just literally can hook them on. But you can tie them up quite easily. They just, it's no big deal. You can even put it around your knees or one knee and just work this, because this also is rolling over. So if you need help with that, that's how you help yourself. Function. I'm always about function. So, if you're having trouble rolling over, again, just belly out, and I'm right there.
That's great.
Just little simple things.
Okay.
So, please, this is all new to you, 10 to 15 minutes. Even if you do it, wake up, oh, my bands, you can, it's just stuff to be there.
Yeah.
Oh, also this kind of twist too, eventually. But maybe not right after surgery. Work on your doctor as far as when you can do
Rotation.
That kind of rotation. But notice I'm not rotating, I'm not stressing the back. Even if the back stays still, I can still work on, because you want all these muscles to be there. That's the hardest part. When you start using a walker, you're not used to those kind of muscles working. So even if you do it ahead of time, to work on something like that. But
can you finish the rollover and do the sit-up?
so yes, roll over, again, just right here, rolling over. Now you want your feet off the bed, so you're not going to be able to get up this way, and you're never going to be able to get up if you're looking back. This is what people do, and they have to use, I'm stuck. I have to use brute force to look up. So the quick way is you just look down, and you're really that fast. But obviously, you just bring the feet over here, and that's even good for someone assisting you. Just say, give me a second, versus someone bringing your feet over. I'm getting there, I talk with them, I know I had to get my feet over, and just, if anything, help me here, I'm looking down. You can do it as small as to your elbows, but that's gonna be a little bit hard because of the rotting, depending on where it is. And just literally look down at your hand. Eventually, no problem, I can look here and cantilever. But to start off with, that's your safest. Now again, when I say make sure your feet are under you, you don't want the 90-degree angle, that's like an AFO or a cast. The feet are underneath you. You can do this way. And again, I look at my feet and then I walk up my body. Or I'm here or literally here. Let's say if this foot hurts and I can't bear weight as much, I can easily come here and just push up here. See, I'm still until I'm stabilized or whatever. But what's nice about that one too, getting out of the car. So let's say this is your purse. So I'm right here like this, my purse is here, my arms are like this, I can literally slide like this and then get up as well. So, yeah.
You've turned yourself so your knees are out of the door.
Right, yeah. Because otherwise getting in a car that way, you push in this foot and go like that.
Yeah.
But it's the foot. This is much harder than starting to use your feet. Yeah. But again, that twist is going to be up to, the conversation between the doctor. And usually it's about 6 weeks, but I'm more used to open heart surgery.
Before...
The full rotation can be looked at. Like getting keys off the floor. If you drop your keys, you better be looking for your little alligator versus twisting down.
Yeah. But to get in and out of a car,
you probably have to do this move here where you're going across. But once you're there, you can
Then
literally,
you can stand.
especially if it's a lower compact, because I don't know your vehicle, you just can come out on your knees. Because if your knees like this are above, this is where this kind of move probably be good for you versus this, because the knees are above the femur. And you just come up.
Oh. So,
See there? Yeah. So same thing getting down. You don't want to fall down. Most people do, we're so used to doing that, but that's a fall. And after surgery, So same thing. If you're concerned about it, put your hands here or slide down a little bit. So see, it gets you just, and you're literally almost sitting. So just think your hands sliding down.
that's great.
So, and then stabilize first and then take your step. Don't just go, because sometimes blood pressure and all that sort of stuff, you've got all your stuff around you, and that really should work. If you're using the tubes, these are really nice, but you can also tie them for the feet. You know, put a loop in there for their handles and work them on the feet that way. Also, another thing that's nice about the tubes, you can do 2 feet and then pull up this way. Because that's a little exercise. So that's what I'm going to show you too. So you're in your chair, you're working on your skill. So you can be right here, tubing, or this is a great little exercise. This helps me get my feet up, come to, but literally in the chair, rising the feet.
Oh, okay.
Just early stuff. You can do 1 foot. And that could be, again, working on putting my socks on.
Mm-hmm.
You cannot put your socks on with one hand here. Your brain thinks this is standing. You just can't stand and put your socks on. This is very difficult. People don't realize what I have to do versus, again, trying to get my sock on. But this...
If you're trying to put your sock on, then your both hands are here.
Correct. But some people kind of do this with their shoes, and they do this. But look at where I have to go now
Yeah.
versus the 2-hand here. But again, with the bands, what's nice is it can be right there on the floor if you're still having problems, and you can use this to help you get your foot up, even if you have an itch, you know, or something like that. You know what I mean? Like just little things when you're tired.
Yeah.
Now this also is a nice, not only stretch, but you can start rotating through the leg.
Oh, okay.
You know, those little things.
Those are good things, even in the hospital, if I'm able
Right.
to sit up for a while.
Right. Doing with 2 feet. And again, you can practice driving a car,
Okay.
you know, just that. And then you can start eventually looking while you're driving, kind of thing. You know, looking around, getting used to that. Looking. It's much easier to look around using your feet. If I'm not using my feet, this can be a lot harder
Okay.
versus foot down. Yeah. So,
Right across the body,
right.
yeah.
But those should be a lot of little things that you can just
Oh, yeah,
practice
that's great. Well, I can
on.
bring those two to the hospital then,
Right.
because I,
That's what I love about these things. They're so light. And now the ball, I try to deflate a little bit, but it should be fine. But that's another thing, you
I
know.
could get a smaller ball.
No, it's just that if it's too pingy. But literally, you can be. I'll do this. So this can be like your hospital bed. The bars are up again. And you can just be on this side. And just right here between you and the bed. And just feel just the light. See, I'm not twisting or anything, but this is really going to help you go to the bathroom. You know, just that pressure of using the sacrum, bringing that through, and getting used to the surgery and all of that. Because that's what people are afraid of. So they tuck their tail because it hurts, especially if a stool's building up. Sorry, TMI, but it might happen. And you know, you have to let the coccyx go to eliminate. So that's why I did this video, because this woman had a colostomy, so she never did this anymore, and her hip's really hurting. But all of these muscles, you know what I mean? And
Okay.
that's where, but forget the bathroom, you can put the ball up here, and play with that eventually. Again, that's probably gonna be more post-op
Yeah,
healing.
yeah.
But again, so you can start feeling pressures on your back. The reason the pressures on the back will help for eventually when you start coming to roll over. So you're not, you know what I mean? Learning how to roll over is gonna be so much easier, literally like by pushing the ball in.
Okay.
And it'll give you more feedback versus, where am I, oh, I'm afraid to fall over kind of thing.
Mhm,
But that's where too, even a pillow to, something to squish.
mhm. Okay.
In contrast to the myriad of conventional therapies, a movement lesson is a progressive, scientific approach that is based on her theory of the opposition of gravity and the principles of movement affecting development. More specifically, a movement lesson utilizes a unique combination of gentle touch and purposeful movement through the principles of counterbalance and rotation to create an individualized and profoundly effective movement lesson session.